Michigan's Children proudly presents Speaking for Kids, the podcast where we explore crucial conversations impacting the lives of all Michigan children, youth, and families, especially the most vulnerable. Join us each month as we explore public policies and issues in the best interest of our kids and families. We'll bring you lawmakers and policymakers, advocates fighting for change, and the people most affected by those decisions. With our host, Matt Gillard, President and CEO of Michigan's Children, we'll invite you to become engaged too and show you how to take action on what matters most to you. Episodes are recorded live and shared virtually on YouTube and the audio hosting sites Apple Podcasts, Google Podcasts, and Spotify.
Hello, I'm Matt Gillard, the President and CEO of Michigan's Children, and welcome to another edition of Speaking for Kids, a podcast brought to you by Michigan's Children. Well, I'm excited about the topic and the guests that we have today. Children Trust Michigan is a wonderful organization that does great work in Lansing and throughout the state of Michigan, and a proud partner of Michigan's Children and a group that we've worked with closely for a number of years. And so I'm excited to have some folks involved with that work here today to talk about the work that they do and bring people kind of up to speed on where things stand and maybe what's needed to continue to move forward on this important work here in Michigan. So today we're joined by Suzanne Greenberg, who's the Executive Director of Children Trust Michigan. We're also joined by Stephanie Detloff, who's the Executive Director of Child and Family Services of Northeast Michigan, and Heather Fisher, who's the President and CEO of the Child Abuse and Neglect Council in Saginaw. So welcome, ladies, and thanks for joining us today.
Thanks, Matt. Glad to be here.
So, Suzanne, why don't you start, kind of give us a little background on Children Trust Michigan, the organization, the entity, and kind of how it works.
Absolutely. We are proud to be in the state of Michigan and serving kids and families across the state since 1982. We do that through an amazing network of partners. 2 of them are here today. And there's over 100 partners that we work with that are the voice and the active provider of services around preventing child abuse and neglect. We work towards strengthening families so that we can keep our kids safe. At the end of the day, Children Trust Michigan exists because we are the only Michigan agency that solely focuses on the prevention of child abuse and neglect. We have a lot of partners, and we're proud to work with anyone who's interested in helping us keep our kids safe and strengthen families. But we know that that's our focus no matter what, 24/7, and we do the great work through our partners. And so when we really got started, we were doing primary prevention only, where we worked with families who could receive any services, children and families, open to all, essentially, as a prevention service. But then we really got into direct service work, where it was really about secondary prevention and families that had a little more challenges, a little more risk factors. So we have services to answer to them. But now, in the last 3 years, we've been working in a realm called Family Resource Centers that have really proven to be an amazing response to a community that is, it's by the community, for the community. And essentially, I'm going to ask my partners to please talk more about this, but I want you to know that in 2024, our 11 Family Resource Centers had provided over 85,000 services, serving over 44,000 children. That is huge, and those services would definitely be missed as we are in a financial crisis and not sure how we're going to get them funded after September 30th. So we're here because this work is vital to the community, and I would really, I'm grateful to have our 2 of our partners here. There are 9 others, but they are located throughout the state. Frankly, Family Resource Centers are a welcoming place where services are provided that reflect the needs of the community and reflect the community. So I'm going to be quiet now, Matt, in case there's any questions for me, but I definitely look forward to hearing from.
Oh, we'll get back to you for sure. For sure, Suzanne. Don't worry about that. But yes, let's hear from, so this is really the front line, right, of what we provide, what we see as service provision to children and families here in Michigan. And something as Suzanne alluded to, that we have unfortunately been historically really underfunding here in the state of Michigan. And so we'll get into that a little bit later, but let's hear from Stephanie and Heather about some examples of some of the work that they do in their communities and some of the importance of and really what they're seeing in their communities in these times. So Stephanie, you want to start and tell us a little bit about the work you're doing up in Northeast Michigan and helping families?
Sure. So we are Child and Family Services Northeast Michigan. We have rebranded actually into the Northeast Michigan Family Resource Center. So we've gone through that whole rebranding. And I'll get to the rationale for that and the importance and value of keeping our family resource centers afloat. But our agency right now consists of child welfare programming and prevention programming. So we have foster care, adoption and licensing, We have our Healthy Families America Day One home visiting program. We have a Compass North homeless youth runaway program. And then all the services that fall under our Family Resource Center, which are so new and exciting, because we're doing some more prevention programming through additional evidence-based parenting education, which has been a critical need in our area. So certainly offering more training to help parents with that positive parent-child interaction and reducing those risks associated with child abuse and neglect. And we're also certainly expanded our services. So we were in 11 counties. We are now in 14 Northeast Michigan counties. So we have gone through a tremendous growth, and we could not be where we're at as a family resource center if it not be for the Children's Trust of Michigan. So with the ARPA funding that we got, we were able to kind of launch our Family Resource Center, which was very important because we're doing a whole paradigm shift with programming here in Northeast Michigan. So under our Family Resource Center, we are adding on, like our goal is to add on a children's museum, a family resource lending library, plus all of our prevention program, and a community-based hub of volunteers. So why is that important, and why are we connecting all these together? So in the field of child welfare, we've seen, and working with, children who are going through the foster care system, some of our most vulnerable families really need a space that provides a sense of welcoming, where we can do more targeted modeling and approaches to helping strengthen children, youth, and families in a place that feels less vulnerable. And so certainly opening up a museum to the public, as well as having that for our families, is such a unique, different shift in terms of how we're supporting families. The community-based hub kind of came out as a result of the devastating ice storm that we had. We found we need to mobilize and be more responsive. Some areas did that very well. Some areas really struggled. So under the umbrella of our Family Resource Center, really kind of creating that space where we're pulling in our families who we know have assets to contribute and to give back, bringing them in, as well as our other community partners that we work with, our faith-based organizations, the community at large, really kind of having this one-stop place for prevention programming, targeted outreach to the community, more just opportunities that will enhance all services within our prevention services within our 14 counties that we cover. So yeah, it's so critical because we just got the groundbreaking work done for this. And so the Children's Trust, again, has been such an instrumental part in being able to launch this for us, to where we've developed other partnerships and working towards bringing that into the private sector, so that we have more financial capacity and stability. So yeah, there's a lot going on, and we really cannot do a lot of this work if it weren't for the Children's Trust Michigan. So they really were the groundbreaking spot that helped us to launch all of these initiatives.
Absolutely. No, it's incredible the amount of work that you guys are doing, and really sister agencies like yours around the state that are doing with really relatively little resources, publicly funded resources. And I've often said that it's amazing the amount that is able to be accomplished. And it's really a tragedy or a travesty that we're not putting more state money into these programs and into these services to help support the work that you're doing. So Heather, let's hear a little bit about what's happening down in Saginaw. I know the CAN Council, the Child Abuse and Neglect Council in Saginaw, has been very active for a number of years. I know that's where Suzanne came from before her role now. And so talk to us a little bit about what's happening down in Saginaw.
Absolutely. Thank you, Matt. And Stephanie said so many things so well that I won't repeat all of that, but what I will add to it is, yes, so I represent the CAN Council. We not only serve in Saginaw County, but also Bay, Aranac, and Huron counties. So we are reaching 4 counties with our services, and not only just, I don't want to say just prevention. Prevention is what we're here to talk about today, and it is the backbone of what we do, but we also serve in the realm of intervention and advocacy as well, through our Child Advocacy Center and our CASA program. But today we want to focus on prevention because really that's where it's all at. We'd love to put ourselves all out of jobs, to be honest. But what CAN Council was able to do also with ARPA funding, as Stephanie talked about, was to not only build a family resource center, but to make it mobile. So we have we call it the Rolling Family Resource Center on wheels. It's a 29-foot RV that we are able to take out into communities, because not only do we serve in urban, suburban areas, but also definitely in rural areas. And I think Stephanie probably feels that too, reaching 14 counties in Northeast Michigan. There are unique challenges for every county, not only every county, but even every city and town and village we touch. There are such unique needs for each of those communities. Sometimes it's just having Wi-Fi be out and about so that our community partners can log in. So on our 29-foot RV, we have Wi-Fi. But the idea here is that we can take that vehicle out and deliver resources as needed. Maybe they are concrete support things. Maybe it's cleaning products or personal hygiene products or coats and hats and mittens. We're able to go out and sort of survey the pulse of the community. What are the needs at the time in the space and in the place? And take those resources. But then we can also bring community partners along and set up all together, because we all know we could drive around. Let's say we were an individual that was looking for resources. You could drive around your community all day, filling the gaps of all the things you need. We can take that out in our vehicle with the community partners on, alongside us or on board, and serve many needs all at the same time and in the space that we're able to go. So it might be, we have a couple of apartment complexes in our region where hundreds of families live. Many of them are, what would be considered probably more vulnerable for having either financial needs or material needs, family support needs. And we can take that vehicle out right into their parking lot and bring all of our partners with us and serve them right there. So that vehicle was able to be purchased through ARPA funding. And now we have to keep it funded and keep it out there, keep it serving people, because we worked so hard for the last year to build that relationship so that the folks that are out there wanting those services know where to go to look and have that trust. We've built that trust, and now it's time to continue serving them.
Absolutely. No, and I think the examples you both, Stephanie and Heather, laid out prove the point that we've often made, that these agencies and this work is really a backbone, right? They're backbone entities in these communities in providing services to the families and children, especially that need it the most. And the prevention angle of this is exactly what we want to talk about. And I mean, everyone, and this should be so easy for legislators and decision makers and policymakers to grasp, is that we all want to prevent, right? Nobody wants to triage child abuse and neglect. We want to prevent child abuse and neglect. And so what we're talking about in the context of a state budget is such small amounts of investments that can go such a long ways in these communities to really having dramatic and significant impacts for kids and families in these communities. And so, Suzanne, let's get back to you a little bit. You alluded to it in your opening comments, but you and I have been at this a long time, and unfortunately, Michigan has historically underfunded this work, and has done it through a number of different ways I call gimmicks, legislative gimmicks. We refer to them as kind of the bake sale approach, right? Where we've done things like the license plate, where people could choose a license plate, which was much more lucrative when there were only a few options. Now there's a ton of options out there for license plates, and the income tax check off, which was another kind of gimmick, but nobody files taxes that way anymore in a paper form. And so even these revenue sources, which even at their heyday were insufficient to really fund this work, have really dried up. And what we really need is for the state to get serious about investment into these agencies and the work that they're doing. So talk to us a little bit, Suzanne, without getting too much in the weeds. I know this is hard for you and I both, but without getting too much into the weeds about kind of where things stand and what we're looking to do and what we'd like to see as far as investment from the state, from policymakers, the governor, and the legislature here in this upcoming budget.
Absolutely. Thanks for the softball there, Matt. I'm going to take it and run, because bottom line is that people don't seem to understand is that though we are administratively housed within the Department of Health and Human Services, we do not get program dollars from the state. I think that's a really important point. I'm talking to so many people who don't think that we have a problem with financials because we're right in the state government. Of course you're funded. Well, we're not. And we have funding that comes to us from the federal government through what's called community-based child abuse prevention programming, which is being threatened to be cut from the federal government. We can match that with local and state dollars, but we don't receive state dollars. So we do have a big fundraiser that we do in May. But frankly, we, as you've said, we are woefully underfunded and have been. We have representation in serving every single county. That's 83 counties across the state. And I would invite people that listen to think about where they grew up, where they live, where their family may have a cabin or cottage, or they went to camp, all of those areas across the state. We have partners that are serving kids and families there. And it's important for folks to understand that in a very simple way, our budget was very impacted by the ARPA monies. You've heard the great stories about what folks were able to do. We're talking about serving 44,000 more children through these 11 spaces. We are making proposals every day to different individuals about how we could do more to strengthen these 11 and then expand that. But I want to share one quick thing that we just got this week, and it was a study done called the Social Return on Investment Study by the National Family Resource Network. Essentially, they studied Teller County, Colorado, and learned something that I think is breathtaking. 82.84% reduction in substantiated child maltreatment cases in that county over a 3-year period. We have been in service for 3 years. As you heard them talk about, you heard Stephanie, you heard Heather talk about, some of them have been gearing up for lots of different reasons, but we have been serving in these communities, and that's a possibility. That level of reduction of child maltreatment, my goodness, why aren't we investing? And frankly, here's the ask at the state level. It costs about $40,000 on average for a foster child to be taken care of for a year. Last year, there were about 10,000. We're asking for 1% of that, or $4 million from the state legislature, to help us not only keep our 11 resource centers, strengthen the prevention work they do, but then possibly even expand and have more places where we can serve families in this way. The reason it works, Matt, is that these are very welcoming spaces. The people, and we had a parent advisory group that helped us even create this at the very beginning and said, you need the people inside to look like us. And we need to help you decide what services are going to be in there. And I'm like, we don't tell them what to do. We ask that there are parent, hopefully evidence-based parent programs that are available, or resource and navigation services. But the truth is there are some basic standards, but these centers look and serve the people, they look like and serve the people from that community. I heard it once said here in the department that the solutions are right there in the community if we listen. Well, this is an example of how we've listened. And it is, they literally each of them received $110,000 from us. That is nothing. And the services they're able to match local dollars, yes, we'd like to give them more, and we absolutely would when the dollars come through. But they then attract dollars locally and build on that program. So this is a way also for communities to respond to their needs and make things happen for themselves with support from us. We're not driving it, we're supporting it. And it really is so critical. I would invite anybody to go visit. I know they'd be open for visits to go see. That rolling center is amazing. They brought it to the Capitol that day that we were there in April. It's really an amazing program, and each of them have responded to their community so that it works. Like Stephanie's program, you heard all the building happening. It's because there's a need and a want in that community, not because Stephanie's programs are saying, you're coming in, we're doing what we do. It's not about that. And so anyway, I'm thankful for this opportunity, Matt, for people to hopefully understand a little bit more about Children Trust Michigan and why we exist. And it's because of programs like that.
Absolutely. No, and I think you made a couple of really key points. And so, right, I mean, these programs are able to, because they are regionalized and they're local, right, are able to really fit the needs of their communities and listen to the folks that they're serving. And we know what works, right? This isn't something like we're going to try something new. We know what works to prevent the things that we want to prevent. And it's a matter of resources. I mean, and you mentioned $4 million. Now, that's a lot of money, right? And that sounds like a lot of money. But we're talking about an $83 billion state budget. So in the context of an $83 billion state budget, $4 million for prevention, primary prevention services for child abuse and neglect is, I think, not enough, right? And I think most people would think not enough. And I know that most people would think not enough. And so, you know, we hear all the time from elected officials, certainly during campaign season, about how kids and families are the most important to them, you know, and the most important thing. And they want to come to Lansing or go to Washington and represent the voices and interests of kids and families. Well, Here's an easy way to show that and to prove that is by really prioritizing in these budget discussions that we're going to see at both the state and the federal level here in the fall is really an opportunity for elected officials across the political spectrum and both at the state and federal level to really show that support for kids and families by making the decision to prioritize funding for programs like this. So Stephanie and Heather, let's talk a little bit more about maybe some things you could do even with more money if there were to become available, or some trends you may be seeing around some of the issues that you're seeing in your communities.
So we've really framed our organization and all the programming under our umbrella as a protective factor agency. And what that means is we really want to strengthen those areas, parental resiliency, concrete supports in times of need, social emotional competence, knowledge of parenting and child development, and social competence. Because we know, I've seen it, I've seen how communities can break those factors down by little accessibility to services, by just the nature and how we invite families into spaces. And then I've seen the flip side. I've seen when we strengthen children, youth, and families through this protective factor approach, families thrive. And when families thrive, we know our communities are going to thrive. We know economically our workforce is going to thrive. So we have certainly the things under our umbrella with the museum coming up, the Family Resource Center, but other things that we want to start enhancing is providing more resource and referral through doing some more fee-based community services, like having some community health workers, being able to bill Medicaid for those services, trying to kind of move more into the private sector too for some additional funding that's more sustainability. So working with businesses and creating some work-life programs that really are prevention programs that we could bring into the workforce to strengthen organizations and families who may not get access because they're working 8, 10, 12 hours a day. So being able to partner with our private sector to offer those types of things too, but it takes money to do those things. It takes putting those packages of things together to get out there and build that up. So I know I do direct service too. I don't just stay behind the scenes. I'm back as a foster care worker right now, working with some families because I need to kind of see and feel and be the boots on the ground to really kind of experience a day in the life and walk the walk so that as we're building our resources in our Family Resource Center, I can be very intentional about really seeing truly from the ground up what's happening, what the gaps are, what the true challenges in families overcoming circumstances, what they're going through. And I get really frustrated sometimes in social circles when I hear like those people, because a lot of things are situational, circumstantial. And so it's really hard for me because quite honestly, I'm not only speaking for myself, but the other families who we have some great success stories from, but I'm one of those people. And I grew up in the system. I had my own experience with a lot of poverty, abuse related things. And so when I hear that, I always say, but this person, when people strengthened my protective factors, when I had a community surround me with supports, I became an executive director to give back because of that experience. And so it really frustrates me when people just have this mindset of people should just work harder or put their bootstraps on and get out there and get going. That's far from the truth. And so, and again, the flip side of that is I had experiences where people really damaged protective factors within services in the community. So I'm out there building what I know works, building, what I seen firsthand and witnessed, and we do have those written stories, and I'd love to share them all if I could, because the impact is so much greater than we know. And it starts with the seed. Our Family Resource Center is planting a seed that we need it to grow, and because that's what's going to make our communities flourish.
Absolutely. No, you're absolutely right. And it's our neighbors. It's kids in our, or, families in our kids' schools and everybody else. Absolutely. So Heather, how about from you? What are some things in Saginaw that you're seeing or things that you could be doing or if you had a little bit more resource available?
Yeah, no, this is such a great conversation, Matt, because I think what I see and feel is like this, we're always having to chase after dollars, right? Versus just continue with this consistent relationship building, having a consistent presence, listening to these neighborhood partners, and Stephanie's right, it isn't a particular person. I mean, certainly there are folks that are more vulnerable than others, right? But any of us could be in this position at any point to need support in some way or another. Just a decision one way or the other can land us in a spot where we need some support. And so it was just not long ago, the Surgeon General released a report that loneliness has become one of the major health concerns of our nation. So one of the things that we do is we work very hard to build relationships, not just with ourselves and the community and our partners, which of course that's going on, but with parents themselves, with each other, because nobody wants to walk through parenting alone, right? And so to be able to come together and have spaces where they're all learning and growing together and interacting with their children and see things working and learning about money management and learning about how to play with your child and all the things that we teach. And doing that together, it's so much less isolating, and so much, I would say, so less scary, right? It's, and I think it communicates that we're all in this together and we're all growing together, and that's what Can Council wants to do for and with our community. We're all doing this together. So the ability for us to launch this program and have the Rolling Family Resource Center out and about, to the thought of a disruption in funding for all of that legwork that we put in and all of those relationships that have been built is sad to me. And I think about the local community support that has been coming about to support us. It's there. It just needs time to grow, right? So our community wants to support this. They just need a little more time to get there. And when you talk about this tiny percentage of the overall state budget to do this work, it's a drop in the bucket, and yet who doesn't want to keep our kids safe, right? That is kind of a baseline need of a community. And so I'm excited for steps that are coming next. And I have to trust the process, that whether it comes from government funding or our neighbor next door, we're not going to let kids suffer. We're not going to leave kids without support. We will do what we have to do. And like Stephanie said, if that means us getting out there and doing that primary prevention, we will do that. But boy, with just that tiny bit of budget, makes such a difference for us.
Absolutely. And we certainly at Michigan's Children are committed to being in this fight with you all for as long as it takes as well. Well, I want to, any last things to add before we kind of wrap this up here?
I would just say, if people are interested in finding out, they're listening, interested in finding out what else is happening in these great programs, and also throughout the whole state, right in their county, they can go to childrentrustmichigan.org and they can look up, there's a map there, they can find their prevention partner locally and get connected, because there's a lot of good things happening. And I think some of us just really need to know there's some great programs and services happening, and I can get involved and I can support them. And that's what we're asking folks to do.
Thank you, Suzanne. Well, I want to thank all three of you ladies, most importantly, for the work that you're doing and the wonderful work that you're doing in their communities to keep kids and families safe. And also for taking some little bit of time out of your busy schedules to help us inform our listeners and our audience and our networks a little bit more about this important work. Just as Suzanne said, you can find out more information about the work that's going on by going to Children's Trust Michigan. You can find more information about this issue and really the budget process and how to get engaged and how to make your priorities known to your elected officials at michiganschildren.org. And so please, there's going to be very important decisions made in the next couple months at both the state and the federal level on our state budget and our federal budget. Now is the time to reach out to your legislators at both the state and federal level and let them know what you think their priorities should be in those budget discussions. And we certainly know that most of our audience, if not all of our audience, and most people really around the state would agree that prevention of child abuse and neglect should be a priority for all elected officials, regardless of their political affiliation. And so, like I said, you can find more information on how to get engaged, how to get involved, and follow this budget process as it unfolds here for the next couple of months at michiganschildren.org. So thanks again to my special guests today, and thanks everybody for tuning in, and tune in again next month for another edition of Speaking for Kids, a podcast brought to you by Michigan's Children.
You've been listening to Speaking for Kids, the podcast for Michigan's Children with host Matt Gillard. Thanks for joining us. To explore these and other issues relevant to our state's children, youth, and families, and to build your advocacy muscle, go to our website at www.michiganschildren.org. You'll find links and news about past and future podcast topics under our Resource tab and action alerts under the Take Action tab. Find and like us on Facebook and Twitter. And Stephen Wallace produced this podcast. Contact them with your questions and ideas for other topics. Michigan's Children is a nonprofit advocacy organization, an independent voice working to reduce disparities in child outcomes from cradle to career through policy change.